You're listening to the Confident Choice Podcast with me, Dr. Roberto Garcia, a double board certified facial plastic and reconstructive surgeon. Honest conversations and expert advice about the decisions that make you feel your best. Welcome, everybody. We are now in our 12th and final episode of the Confident Choice. I'm your host, Dr. Roberto Garcia, and I got to tell you that it has been a heck of a ride. And I think you guys can all agree, right, Abe? Mm-hmm. Alyssa? It's been fun? What do you think? It's been fun. All right. So the reason we've had such a good time this season, and what has it been, 4 months that we've been doing this? 3 or 4 months? Since the end of January. And we have gotten tremendous feedback with how much people appreciate the transparency of information that we're providing for individuals considering having something done in this field. It is a huge undertaking for a patient to even know where to start. And they don't even know what questions to ask. They don't know who is actually a authoritative figure in this field. And I feel that with this podcast, what we have been able to kind of tie together has really empowered patients, right? And it's that I want you guys to feel super comfortable with this decision, as let's be honest, it's a big decision. And if I were to kind of bring this season together, and we've talked about all kinds of things, we've had guest stars talking about different components of our business. But if I were to kind of bring it all together, now we say or ask, what do I need what's my final set of considerations that I need to have checked off in my head before I say yes? And before I, quote unquote, pull the trigger. Now, I feel when a person comes for consultation, and I can't recall if I've talked about this yet, but I'm going to, that we are, as surgeons, we're pretty much vetted at this point. Now, the only time that I, at this point, find an individual comes in and they say, well, I think I have another consultation, it's really because I was within a small list of consultations that they wanted to see prior to them ever coming in, and they're just being thorough, and they want to see their 3 consultations. And I just had a patient last week who came in for upper and lower eyelid surgery, really, really sweet girl. And she told our practitioner, our patient coordinator at the end, I really enjoyed Dr. Garcia. He's very knowledgeable. He's the second of my 3 consultations, and that happens. I get that, and I applaud that. You're being thorough. So finding the right surgeon, and finding the right surgeon really comes down to, do you feel comfortable with the information that they're giving you? Do you feel comfortable with the cost? Because it can be a considerable chunk of change. And are you aware that there will potentially be complications? There might be the need for revision surgery, as we talked about last week's episode. And do you feel confident that this particular surgeon is going to help you navigate those treacherous waters should you come across them? And I always put the financial part kind of third, because you can find the money somewhere, right? A patient can find the money for surgery somehow or another. They can borrow money, they can get a loan, they can do whatever. But what they can't do is they can't borrow sincerity on the part of the surgeon, and they can't borrow aftercare, right? You can't get a loan for that. That's either there or it's not. So I do feel that having some of those boxes checked is going to serve to provide you with the best possible outcome. So I'm kind of going down my list here, and the other big thing that Amelia was showing me a card here of something that I have to say at the end of the podcast. Thanks, Amelia. She's also listening in, so she's making sure that the audio is good. How's it sound? Sound all right? Yeah. All right, right on. So I think one of the major hurdles, if you will, is that how realistic are these expectations, right? I just saw a consultation today who had been told that some of the folds in her face and some of the hollowing in her cheeks would be addressed with a facelift. And I'm not a huge fan of over-promising things to patients that I deep down in my heart I know is probably, if we get lucky, maybe that'll happen. Maybe we'll get those results if we get lucky. But I'm not hedging a patient's results and success of surgery on luck. And I need to know that there's scientific empirical data behind any procedure that I'm offering to a patient, and knowing, okay, if I offer you this, I know what the results are going to be. And so I always kind of err on more than likely it's going to improve A, B, and C, where in my head I'm probably more confident about it, but I always kind of under-promise, and generally speaking, thankfully, I tend to over-deliver on the results, right? And so I think setting up these realistic expectations with our patients is so critically important. And I think that due to social media, due to misinformation that's out on the internet, and so much just garbage that's out there, that patients are really confused. And they're told that this laser procedure, and I think Dr. Basil and I kind of hit on this laser procedure or one of these non-surgical modalities can solve all of their problems, and it's just physically and anatomically impossible. And telling a patient that you are going to get those amazing results with this minor, minimally invasive procedure, just sign on the dotted line and pay me $8,000, I think it's a disservice. Well, no, it is a disservice. But I hope that with the spirit of this podcast and what we've talked about in season 1, I hope that you guys can understand the importance of doing your homework and not allowing yourself to be bamboozled with just any information that somebody tries to sell you because they happen to be a slick salesperson, I should say. So I think that's another critical element. Another element that I feel is so important is, are you acceptable, are you okay with a less than acceptable result? And the definition of a less than acceptable result is completely dependent upon the terms that you and your surgeon set forth at the outset. Okay? If your surgeon tells you that the results are going to be way up here, and in reality what we were just talking about is unrealistic, and you fall here, you're going to be upset. If your surgeon tells you that your results are going to be here and you end up here, you're going to be ecstatic, right? And so somewhere in the middle of that is where you guys both have to meet. And setting those expectations and the understanding that oftentimes the results that you get may not be the same results that your friend who sent you got, only because their makeup is different, right? I don't say physical makeup. I mean what's inside of them is different. Their the way that their body heals is unique. Their genetics are different, right? You can't control that. And so finding that kind of happy communication, that congruent meeting where you're both seeing eye to eye on what the potential results will be, will more than likely put you into a good mental headspace when the time comes. And that kind of speaks to the revision surgery possibility. And again, I think I talked about this last week, but anybody who tells you that they haven't had a revision is either lying to you or they just don't do the surgery. It's a simple fact. No good chef is going to tell you that they have 100% success rate when they make a souffle, right? They've all screwed up souffles, right? That's just the way you get better at it. And so the question becomes, did I screw it up to the point where it's irreparable? And as a surgeon, and I try to teach other surgeons, don't ever let yourself fall into a surgical outcome where you can't correct that outcome. And if you have something, it's always better to err on that conservative side and say, okay, well, maybe we can do a little bit more. Let's tweak it a little bit more. Let's take a little bit more skin. Let's add a little bit more fat. Let's tighten the jawline just a little bit more. That's a much better place than to say to yourself, wow, now the person can't close their eyes because we took too much skin, right? Or now the person's jawline is so tight that every time they turn their neck, they're in pain. And so these are all things that you kind of want to see with the results that your surgeon that you're talking to or you're interviewing. You kind of want to see their results online, talk to other patients if you can, and you'll get that general gestalt of, okay, this person really has that concept, right? They have that conservative, natural concept, which if I want to add to, I can, and that's a much better place to be in. But, I'm not saying that you should go into any kind of surgery with the idea of, oh my gosh, I'm going to have a revision. No. In fact, the vast majority of my patients, and I would say 95% of them, maybe not plus, don't need any additional work. And I think last week we defined that there's different types of revision work. There's revision work where you are correcting your own work, or there's revision work where you are adding to your own work. And that's exclusive of somebody else coming to see you. And so I think that being in a situation in a particular, kind of this mental place where you say, I'm okay if we have to tweak things or if we have to add to. And a classic example is when I'm doing fat grafting, I always tell patients, hey, listen, I'm going to take a little extra fat, and if I feel that I need to add fat down the line, I have it frozen and we'll add more, and that generally is taken very positively by the patient, And so these are all things, ladies and gentlemen, that I've found over the course of the years that just makes such a big difference in terms of patients' overall success and great outcomes, is if you start kind of just checking those boxes and you get that overall feeling that, yes, this person I know will be there for me throughout the whole process, good or bad. And that person, that surgeon, is not just seeking the good result, but that person is seeking the interpersonal development of my aesthetic interests, and really wants me to become a better version of myself, right? And so, and if it happens to be that the improvement of my aesthetics is what leads me to become that better person and leads me to become that more positive, inspirational person to others, like we talked about in the first episode of the year, then that's a victory, right? That's the whole goal of what we're doing. So if the surgery we do, conversely, if the surgery that we do makes you a completely reprehensible type of person, a hateful individual, that's an absolute failure for everyone. So fortunately, that doesn't happen in our practice. But I have seen it happen to where individuals have what's supposed to be a good experience, and they have the wrong surgery or are told a result that never came to be, and then they spend every waking moment frustrated and angry, and they miss out on life. So what's the purpose of all this if that's what this brings you? You're better off not doing anything, in my opinion, you know? So I am going to do 2 more things. As you guys know, I'm going to talk about my dad. You know we're going to do that. Don't even look at me weird, okay? We do it every week. And we're going to kind of touch base on some of our future episodes that we're going to be putting together over the summer. And I think we should probably look at launching after Labor Day, seeing that we're finishing just before Memorial Day. Isn't that cool? And do they still do that thing where you can't wear white after Labor, or does that kind of depend on what part of the country you live in? You go down to Miami and people wearing white pants on Christmas Day.
Ask your wife. She's more fashionable than me. It used to be that way.
Yeah.
But I still think I see people in white after Labor Day.
You do?
I think.
Yeah, I remember. I remember my grandmother saying something like that years back, and then I was afraid to kind of repeat it because just kind of weird for a guy to be saying that. Again, what did I do? I just said it on a podcast where hundreds of people are listening. But hey, Amelia, I'm comfortable. I'm okay. So listen, Dad taught me something. Simple thing, Amelia, you're going to like this one. I don't think I've talked about this. We'll see. Always be the hardest working person in the room. Have I talked about that one? No. All right. When I first saw it, or when I first heard my dad say it, we were at Gator Growl. My brother and sister went to Florida back in the 80s. And remember Gator Growl would be on a Friday, and then homecoming was Saturday? Yeah. And this year, Bill Cosby was playing in Gator Growl, so you can imagine what year that was. I think the year was 84. It was 84, okay? And I remember we were walking to the stadium, and my dad looked up into the dorms, and he told my brother, you see those lights that are on in the dorms? Those are the guys that are going to make the difference in the world. And that always just stuck with me. And I took that when I was in college, and I said, all right, I am not the smartest guy. There's no question about it. I didn't even know what an Ivy League school was when I was in high school. But I did say to myself, I will be the hardest working guy in the room. No one's going to outwork me. And I took that with me into college, and I was that guy in the library till it closed. I can't tell you how many times the librarian would blink the lights. Has that ever happened to you guys? Have you ever heard about that? That's how they tell you that it's time to go. Okay, back in the day, they would start blinking the lights. I mean, there weren't.
Back in the day when we had to scan newspapers.
Yeah, that we had the microfiche and all that stuff. Huh? You do realize there's a thing called a library, Amelia, where there's books, physical books. Okay, it's not just all computers. Anyway, and they would start flickering the lights, and I knew that at that time I was the last guy in the library, and so much so that my son, Rocco, he's in pre-med. He has the same philosophy. He said, Dad, I don't care what everybody else is doing. I know what I have to do. If I work harder than everybody else, I know I will be standing at the end. And there is no God-given secret to success. God doesn't just pick people randomly and say this person's going to be successful, that person's going to be successful. The people who you find that are successful at the age of 50, 60 onward are individuals that you thought were nerds and were in libraries and books when they were in their teens and their 20s, because they had a commitment that you couldn't see. And therein lies the difference. They wanted it more. They worked harder. And that goes to everything, you guys. It goes to sports. It goes to nutrition. It goes to health. It goes to any skill or talent. The decision that one makes is what do they want to be the hardest working person at? And if you are hardworking, or you are the hardest working person at something, then that is what's going to define greatness. It's not a talent that's bestowed by God. Michael Jordan is not the best basketball player that will ever play the game because God said, Michael, I'm coming down to North Carolina and I'm going to choose you to be the best basketball player. No. Michael Jordan worked harder, shot more free throws, expected more of himself than anybody in the game. I played baseball with Chipper Jones, right? You remember Chipper? You just saw him? How's he doing? Oh, you saw him at the thing at the baseball thing. Anyway, Chipper had a talent. There's no question about it. But his biggest talent was his work ethic. He worked harder than anybody else. He hit more balls in the cage than anybody else. He was earlier than everybody else. He stayed later than everybody else. And that's why he's in the Hall of Fame. So, you young people, get really good at working hard over something. Choose something you want to be great at, and just know that you got to be the hardest working guy in the room or girl. So we move into our second season, I'm going to bring up some topics that I've just, off the blue, Alyssa, been thinking about, that I think will be really good. I got to get my glasses because, well, that's what happens when you get over 40 years of age, Amelia. Your eyes start getting bad. Relish the moments where you can see like an eagle. It won't last forever. All right, emotional transformation of surgery. Certain misconceptions. We're going to get into detail. We talked a little bit about that today. But we're going to talk about some of the major misconceptions that exist in our specialty. What does this procedure do for your confidence? Or what can it do for your confidence? I got to tweak these a little bit, but just kind of cursory. We're going to go over, and I think this is going to be cool, Alyssa. We're going to get some bad plastic surgery examples of people, like in Hollywood or in wherever that people know. We're going to put their picture up, so you guys have to see the video podcast. You won't see this on the iTunes one, and we're going to pick apart what is it that went wrong and why. And I think that's a good time to kind of delve into the psychology of it. Interestingly, kind of what's going on with, you guys see the Michael Jackson movie? Oh, it's so good. Did you already see it, Amelia? You guys got to go see it. Because you begin to see where the mental breakdown, the dysmorphia began. It's really interesting. And as a plastic surgeon, I could see it developing right in front of me. And they did a really good job of showing that. Okay. Instant results, are they possible? We all know the answer to that one. We're going to do some more Q&As with real patients. I thought that was a great thing that we did with Jackie. She was awesome. And along those notes, she talked about this a little bit, how important is health and nutrition and healing, and how do we get you primed and ready for the best possible outcome before the surgery ever happens. We are going to have our anesthesia team, David Armstrong, who is a brilliant young man. Well, he's probably not that much younger than I am, but he looks a lot younger. We're going to talk about different forms of anesthesia, different types of anesthesia, and that's going to be a really cool one. We're going to have a trainer, a lady named Marie Merritt, who is the owner of Momentum Fitness, and she's unbelievable. She's been doing it for years, and she wants to be on the podcast. And then the last one that I have here, should just anybody be doing these surgeries? There's so many people out there that are doing it. And again, that kind of comes along with choosing the right surgeon, right? The whole premise of the entire podcast. But I think that when you look at, being a little bit more critical of who touches your face, you know what I mean? Right. And you have somebody that goes to, and I've seen those patients. No, I can go to Cartagena and I can have a facelift done for $2,000. Well, guess what? When it screws up, because it will, then you're going to have to pay a large multiple of that to correct it. And you think that doctor in Cartagena 2 weeks after you get back here to Jacksonville is going to be interested in helping you? It's not. So anyway, we'll get into that a little bit. So in conclusion, on behalf of Amelia, Alyssa, Amy, Lori, we thank you all. It was a great season. Had a great time. We had some hiccups along the way with the AV stuff. I think we've worked it all out. Our team is amazing. I'm thankful for all you guys for being here. It's been a great season. Next year is going to be great. We're going to the Golden Globes, Amelia. I feel it. And I hope you guys have a wonderful summer. Love you all. And remember, final words I can tell you, good decisions come from good information. I'm Dr. Roberto Garcia, signing out for now.